Welcome back. Now, 6 years ago, the Competition Commission conducted an extensive health market inquiry raising concerns about concentrated ownership structures in the healthcare industry, highlighting that it could dampen competition in the market and likely foster collusion. Now, these warnings appear to have fallen on deaf ears. A new report by Open Secrets reveals that a number of private hospitals and medical schemes are still making big bucks thanks to ongoing market dominance, with nothing seemingly have changed since then. Alex Van Den Heever, healthcare governance expert from the Wits School of Governance, joins us with his assessment of the private healthcare industry. Alex, thanks so much for your time this afternoon. And let's start there. As mentioned, the warnings are falling on deaf ears. Do you think authorities, government have done enough to address the entrenched concentration of ownership in private healthcare?
No, they've done basically nothing. So healthcare markets and systems are complex, and that's why there was a 5-year a competition commission investigation into the market to essentially look for the systemic issues, and then to look at how you would address these problems, because they are not purely about breaking up monopolies or oligopolies or market concentration. They're about looking at the conditions that allow this to happen, and so you have to intervene. And it's structural, it's not punitive, but government has basically done absolutely nothing.
And you've also said that the Open Secrets report is analytically weak compared to the HMI. What were the HMI's most critical recommendations, I guess, that aren't implemented? I mean, as you've mentioned, not much has been done by government.
Yeah, so the recommendations are focused on the systemic issues, and in essence, its approach or its understanding is that competition throughout the entire system is driven from the purchaser side.
Yes.
So if the market concentrates on the purchaser side, on the medical scheme side, then you're likely to have concentration and problems with competition on the provider side. So it basically says that you have to now have a number of interventions to make the competition operate properly on the right features of the system at the funder level. And the current market functions so that it competes effectively on broker commissions and health status, tries to get young and healthy people. It doesn't compete on features such as the actual cost and quality of healthcare. So what it basically gave as a set of recommendations is to invert that equation. It's to shift the whole focus of competition on the funder side to the cost and quality of healthcare. And to do that, you have to introduce a number of measures that essentially remove the incentives for the other types, basically the poor forms of competition, the forms of competition that produce adverse results, such as competition on broker commissions and health status. And that's risk equalization, social reinsurance, a properly administered system of mandatory minimum benefits that are in place so everybody competes on the same grounds, and that you can have small players enter the market much more easily. That's through the social reinsurance mechanism. And on the provider side, that there is a need for transparency. So there's a need for transparency across the system, which means that there's meant to be a system of, let's say, compelled transparency on performance, so that consumers and people who are making decisions about who they choose to be, which medical scheme to join, and which provider to use, they actually have information upon which to base those decisions. Now, currently, people don't have any information, so consumers are locked out. They can't make efficiency-based or quality-based decisions. So all of those they're complex. And you need to basically look at these very, very systemic structural interventions to get the market itself to work differently. If you don't do that, the individual private actors themselves will continue to act as they do today, and the market will just consolidate and become more and more inefficient, and you basically lose all of the benefits that you have of a market.
I mean, in your view, why do you think there's been such limited political will to act on the HMI's findings? I mean, at the end of the day, it would help the consumer, the ordinary South African citizen, to access, I guess, more affordable medical aid schemes, more affordable access to private healthcare as well. I mean, also, if my memory serves me correct, the Health Ministry only started implementing some of the HMI's recommendations at the beginning of the year, when the final report was published in 2019. It just seems like there's no rush to get the industry in order.
Well, I'm going to make a sort of a rather nasty comment. I think that the Minister of Health and the Department of Health have actually wanted the private sector to fail because they want to create a case for national health insurance.
Yeah.
So part of the reason that they don't have a focus on correcting the market imperfections of the private sector is because they essentially want to centralize everything in a national health insurance fund, which is not possible. It's not going to happen. So the problem is that the system languishes and becomes more costly, and in some ways that's in the interests of these people who are trying to push for NHI, which can't be implemented. So it's really shabby and problematic, because effectively people are being unfairly excluded from the private sector because it's becoming more costly for systemic reasons, and government is basically failing to act. And the market inquiry, it's important to note that right up front, the market inquiry placed the onus for correcting these imperfections squarely on the shoulders of government.
Yeah.
It said that the market failures are a consequence of government failure. Everybody has to intervene in healthcare markets to make them work efficiently. So around the world where you have these kinds of healthcare system, private systems in place, you must regulate them, not over-regulate them, not micromanage them, but have a number of systemic measures in place that make competition work better. And that's basically what government has been averse to. They don't want it to work better. They wanted it to fail. They want to be able to point to it to say, look, the high costs.
Yeah.
You're being treated unfairly by private actors. But actually, government hasn't done its job.
And quickly, before I let you go, Alex, I'd like your thoughts on the SIU's damning findings around looted funds at Tembisa Hospital. Now, money meant to ensure that the hospital ran properly and that South Africans have access to healthcare. What does this say about accountability in the system?
Well, this is another example of government failure, because in essence, the Tembisa situation has allowed people to buy properties in Clifton and Balito and so on from the money that was going to a public hospital. And it's not only that hospital. That's the only one that has been focused on. What you see in the extraction methods at Tembisa Hospital is widespread. It operates at municipal government level, provincial government level, and within health departments across the country. Because when you see the levels of irregular expenditure that occur on a recurring basis, multiple 10-year continuous years, no change, and you're seeing the same picture. That's already an indicator. When you dig into it, you find out exactly what's happening at the facility level. So yes, what you have there is there appears to be no political will to actually address the systemic causes of blatant, brutal theft from the public sector, and in particular the public health system, because it's got such a large procurement budget. And that's basically all the departments that have large procurement budgets are targets for criminals.
Yeah.
And what we're seeing also in the Mandlanga Commission is that these criminal networks are in a position to influence investigations of themselves through the way in which they influence politicians. Today, they're very much talking about payments to politicians and how they're processing them so that they can crush investigations into themselves and their networks of extraction. And those are the very people that have been identified in Tembisa Hospital, your Vusi Musi, Kat Matlala, etc. It's astounding. One person with 520 million rand that they've extracted from one hospital in a relatively short period of time. Just to note that all of this is happening in a system where you can actually see everything that's happening quite easily. In the SIU report, there's 3 years of where Tembisa Hospital exceeds its budgeted allocation by over 3 times. Three consecutive years. And you're telling me that low-level officials are the ones responsible for that. That type of information, I ran the budget for the Gauteng Department of Health in the latter part of the 1990s. And you would never let that happen for 1 month, 2 months, let alone 3 years. And you do centrally. You can check that. Your hospital manager will be on the carpet to explain what is going on there, and you can go through every item of expenditure and work out what's happening. But for some reason, low-level officials were able to do that for 3 years without anybody in the central office doing anything. And that's where I completely disagree with the findings from the SIU that the top level of the department is not responsible. That is impossible. Then the PFMA means nothing in government, which places an obligation on the accounting officer to make sure that this doesn't happen. Quite clearly, they let it happen, and they let it happen at a senior level. And when people at the head office of the Gauteng Department of Health identified this, they were assassinated. So this is what's happening in the public sector.
All right. Unfortunately, we have to leave it there. Alex, thanks so much for your time and sharing your analysis with us. Now, that was Alex Van Den Heever, healthcare governance expert from the Wits School of Governance.